Heparin is the first anticoagulant drug which is used to keep the blood in fluid state. And initially, when it was discovered, we needed something to do surgeries to keep heparin from clotting. So for such a long time, it's the only drug which can be given to patients to keep the blood in a fluid state and not have any thrombosis.
Cardiovascular diseases such as myocardial infarction, stroke, or renal diseases, or thrombosis, pulmonary embolism, there are currently about 12 million per year all over the world, and of these about 30% of these patients, they will die just from pulmonary embolism caused by deep vein thrombosis. And this number is increasing over the next 10 years by about 30%.
Now is the centenary of the discovery of heparin, and we want to celebrate this with a meeting, an extra meeting, and we collect a number of people, and we are very happy that the initiative have a success.
So what I'll be speaking about today is recent efforts really to take molecular level characterization techniques and apply them to the control of heparin to make sure heparin is safe. And this evolved out of the situation that occurred in early 2008 where heparin unfortunately was laced with a contaminant called oversulfated chondroitin sulfate. And that unfortunately caused some severe reactions in patients who were receiving heparin, and ultimately probably led to some patient deaths. While I can't say it's never going to happen again, I would say it would be very, very difficult at this point for a contaminant like oversulfated chondroitin sulfate to re-enter the heparin supply chain.
For the anticoagulant purposes, I think the unfractionated heparin, as we have used for the past 50 years, will still be the drug of choice. The synthetic drugs are very useful. They can be used for preventing thrombosis and some other purposes, but they cannot be used for surgical purposes. They cannot be used like for open heart surgery, hemodialysis, because these drugs are single target drugs.
Heparin have 100 years, but we have more to do after this, and more to study, and also the use of heparin for the future is open. Heparin have a future now.